Welcome to Care Talk Shorts, where we take one important healthcare issue and explain it in depth. Today, we're talking about guns and public health. John, is gun safety a public health issue?
Of course, it's a public health issue. Public health is defined by a subject worthy of research that could potentially, looking at data, help the health of the public, and that research should be used to drive public policy. How could you take the other side of an issue that results in 40,000 violent deaths every year in the U.S.?
John, I didn't take the other side, but one reason we're talking about this is that in 1996, something called the Dickey Amendment passed.
Unfortunately.
And in fact, that meant that the CDC was effectively banned from collecting data or doing research on gun deaths and gun safety. Now, Dickey himself, before he passed away, actually decided that had been a mistake, but that's kind of where we are at the moment.
Well, I think that, and you saw last year, I believe it was, the NRA tweeted that doctors should stay in their lane. This is crazy. I mean, we've got a growing issue, in many ways, an issue that is rising because of violent deaths by suicide and guns more than murders. But guns, we are a gun culture. We are going to have guns. We have to study it. I don't really see the other side of that, and I think it's really being driven much more by the politics than sort of the thinking.
No, that's fine, John. And, we often disagree, but I think we agree here it's a public health issue. Just to go a little bit more into what you said, 40,000 gun deaths a year in the U.S., about 25,000 of those are suicides, and over half of suicides are by gun, and about 15,000 murders, of which over 75% are by gun. So it's clearly, a major issue that's here. The NRA tweet really got under the skin of doctors, so to speak, and also moves to say, hey, physicians, you can't talk about guns when you have the same way when I go to the doctor or the pediatrician, they'll say your kid is 7, they like to touch the stove, be careful with the stove. They're not supposed to talk about guns.
But a lot of the advocates who are fighting against the research, it's a little rich because they're also folks who blame all violent felonies by guns on mental health. I mean, there's this tricky dance that people are playing. We'd never say that mental health is not an issue that we should study. We obviously would study that. And so when you've got that many suicides and rising by gun, we have to study this. And I think it's not a small issue. And I think that it's being driven by the politics versus the research. And we actually right now need more folks advocating because there needs to be a search for common ground. I mean, do you think there's any common ground here?
Well, John, a lot of times you ask me about what am I afraid of? And I think what we should do is to understand why is it that somebody would actually oppose this? Because I think on logical grounds, you can't oppose doing research. I think the opposition is because there's a concern that the research will lead to guns being banned. Now, if we look at other public health issues, I think cigarette smoking and automobiles are instructive. On the automobile side, what happened is looking at this is a public health issue, is cars became safer over time. There's certain restrictions and guidance for teen driving, but cars are still on the road. They're better than ever. People enjoy their cars. Cigarette smoking, on the other hand, the research shows, it's dangerous. People shouldn't smoke. There's more restrictions on smoking. There's less smoking now than there was. I think the gun folks are concerned that it may end up like cigarettes.
Well, I also think the politics have gotten to the extreme. The average American actually believes in, whether it's background checks or a lot of sensible gun legislation. But we're not talking about legislating or regulating guns here. We're talking about research. And research could add to safety. It could add to a different view of how we approach the delicate issues around mental health and risk of suicide and depression. There's a lot of work here that's got nothing to do with gun legislation. And I think the time right now is ripe to actually, if there was any time, it's after we've seen the rise in deaths by suicide by gun and just the rise of mass shootings. There's a lot of things that I think are worth unpacking from a research perspective. And I think public health is the right label that might create a more neutral conversation where we could search for common sense gun legislation.
John, I think it makes sense as you described. You asked about common ground. I didn't really answer that. I think that in the same way that you have safety matches at home, people still have matches, but they don't light so easily. Kids don't light them and set the house on fire. Safety mechanisms for guns. No one wants to see an accident in the home if a gun is stolen, for it to be disabled and so on. So I think that actually having the research to see what works and what doesn't, you may find some common ground on that. You see on the physician side, the physician involvement, They want to be involved because there's no doubt when someone gets shot, you bring them to a doctor. You don't say that's not your lane, right? You say that you're going to go to the physician. Now, what's also happening is that I think younger people, especially people who've grown up, this wasn't us, but grown up in the area where they're actually concerned about, active shooters at schools, they don't have the same kind of, just respect for the Second Amendment and just expectation, gee, this is all fine. At the same time, the judiciary is maybe moving in the other direction. So I'm not sure where we're going to end up.
Separate the politics from the healthcare policy. The politics of guns are always going to be tough, and that'll be the pure regulation of guns will be something that'll be argued by the politicians, and you and I probably agree on that one as well. But there's no solid or valid argument against doing the research to see whether there are common sense ideas and solutions that we should at least be discussing, whether it's making guns safer, making homes safer, providing more mental health access to people that could play into reducing the number of deaths by gun in the U.S.
Well, John, it's been a good discussion. Let's leave it there. So that's it for this edition of Care Talk Shorts. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thanks for watching.
Hey there, listeners. Want more Care Talk? There's more to be had in our other episodes, so be sure to look for those and subscribe to Care Talk on your favorite service.